everyone. I hope you are all doing well and are healthy, no matter where you're joining the this episode of my COVID recovery series. Now, tonight I'm really excited because I'm going to talk about an incredibly important topic that's on the mind of many people worldwide. I have no doubt that similar to me, you have friends, family members, and loved ones who are pregnant or are expecting their first or second child and simply have questions about childbirth, labor, being pregnant, and simply caring for their children. Ahead of Mother's Day on Sunday, it's such a pleasure to have my upcoming guest. Dr. Leana Wen is an emergency physician. She is a professor of public health at George Washington University, and formerly she served as the health commissioner for Baltimore. But most importantly, she is a mother of two who have recently given birth to a beautiful and healthy baby girl. She's going to talk to us about pregnancy, going through with that challenging and emotional process during the COVID-19 pandemic, and of course things that we should look out for after childbirth, and of course much more. I also have to mention that Dr. Wen is the author of the New York Times bestseller book, When Doctors Don't Listen, and How to Avoid Misdiagnoses and Unnecessary Tests. And if you haven't already, make sure you listen to her incredibly important TED Talk on this topic. It is my pleasure to welcome Dr. Leana Wen and start the conversation. Let's see. Oh, there we go. Hello. Hi, doctor.
Hi.
Hi, doctor. How are you?
I'm doing well. How are you doing?
Good. Thank you so much for joining. I see all of your great interviews and articles, and then I wonder how you have the time to do all that great work and also take care of a newborn. So how are you doing?
I'm doing very well. Thank you for asking. So baby Isabel is a month old. And I have a 2.5-year-old son also named Eli. And so we are, we're living in these crazy, unpredictable times. But I feel very fortunate to be home with my family and for us to be well now. So thank you for inviting me to be here with you today.
Absolutely. Thank you so much. Our audience is quite international, but I think the questions that I have are really universal questions. And I want to start by asking about what was it like being pregnant? And I know you've written about this and you will share the articles, but what was it like, Dr. Wen, being pregnant during the COVID pandemic? What were some of the daily questions that you had as you got closer to your due date?
There's already so much uncertainty that comes with pregnancy. I mean, I remember the first time I just had all these questions about, what breastfeeding was going to be like, and how I would get any sleep, which is still kind of an answer that I have not yet figured out, or a question that I haven't yet figured out.
Right.
But, those were the types of things that I was thinking about the first time around. And then I thought about issues like, am I going to be able to have my husband with me during delivery? Mm-hmm. Is there a chance that we could contract COVID-19 while in the hospital? Could I even accompany my baby when she went to get her newborn shots and her hearing screens? As it turns out, my husband was able to go with me, but I was not able to go with the baby during all the newborn checkups. And of course, I worried also. There was so much worry during this time around. Including, I worried about whether I would get COVID-19, but also what if I were an asymptomatic carrier and I gave the coronavirus to my providers. And so, I think that for all pregnant people, for anyone actually seeking medical care in this time, I would advise for everyone to make a plan, but be ready for that plan to change. And also to make a list. I mean, just make lists of your medications, your medical conditions, healthcare, your healthcare provider in case you end up in a hospital where your provider is not at. Make sure that you have electronic devices with you in case you can't have your loved one with you as your advocate in the room. At least you can have them on the phone with you in some way. And just know that we're all in this really unpredictable and strange time together.
No, that's an incredible point to mention, that we're all in this together. And I want to talk about this new and sort of rare disease that we're hearing that's out there hitting children. And this sort of falls under my question, where I want you to clarify the fact that there are a lot of information and misinformation out there. You know, as a mother who's expecting, there's a lot on my mind probably. You know, people have a lot to filter through. So, you know, we don't know what's true, what's not. Of course, there are credible news outlets, but there's so much information out there, including this, you know, disease and illness that is hitting children, as we saw in the UK and now in the US, that they are relating to COVID. So can you tell me about that particular issue, and also how moms and expecting mothers can filter through information?
Yeah, it's a really good point about the misinformation that's out there. But I would say even beyond misinformation, I mean, yes, there are conspiracy websites and things like that, but also there's just new research and new science that's coming out about COVID-19 every day. I mean, we forget, just given how much the world has changed, we forget that this is a new virus. And that it's caught the world's attention in a good way, that there are researchers and scientists around the world who are working on this and dedicating all their efforts on it. But as a result, there are many papers coming out and reports coming out about COVID-19 every day. So it's confusing to sort through it all. So I would definitely recommend going to the World Health Organization, the CDC websites for the most credible source of information, and also credible news outlets. I mean, you know what they are, right? The BBC, New York Times, Washington Post, etc., CNN, right? All these are the ones that I would go to for my source of credible information. But understanding that new things are coming out all the time. So, for example, you were mentioning about children. Children are, in general, children do not have the severe effects that adults have, but we're finding that children, just like adults, have symptoms of COVID-19 that are not just respiratory. This is a respiratory virus. You would expect it to give you lung problems and breathing issues. But actually, we're seeing that it also inexplicably so far affects blood vessels. So there are children and adults who have issues of inflammation of the blood vessels, inflammation of their coronary arteries, even strokes in younger adults that are, again, really unexpected results. And so I would just say this is an area that we need to study a lot more, and we need a lot more information going forward.
How can mothers with young children, protect their family and their kids? A lot of cities and states, are easing the lockdown. I'm in Europe right now. I'm in Sweden, and I can tell you that behind me, there's a nursing home, and next to it, there's a nursery. So it's just a very complicated process, and people go out for walks. People, want to get some fresh air. So how can mothers protect their kids in some easy, simple steps, aside from what we already know right now?
Yeah, so even as various states and countries are relaxing their restrictions, that does not mean that we need to let down our guard. In fact, we should know that nothing about this virus has changed. We still do not have a vaccine. We still do not have a cure. And so the only thing that we have is our own ability to prevent this virus from transmitting from one person to another. That social distancing, keeping physical distance is still really important. I would definitely not, this is not the time to schedule play dates and dinner parties and events, and please do not do that. Please stay within your household unit, because we are still at a time of a global pandemic where this is a highly contagious disease. So stay away from others. And I know for those of us who have young children or older kids, or just in general, we feel antsy ourselves. And we may feel the desire to get out there and see people, and it's nice weather, but please don't do that, because the best defense that we have is the ability to prevent the virus from spreading from person to person. Also, the other measures still apply. Good hand washing, covering your mouth and nose when you sneeze, when you go out, to stay at least 6 feet away from others. I mean, these are still the best methods that we have to protect one another, and therefore to protect ourselves and our families too.
Absolutely. You mentioned vaccine, and I want to talk about that. I think internationally people are anticipating the release of, the first vaccine, and when would this be out? Where are we in developing this vaccine? Do you think the United States has a better chance of developing this, or another country that you know of? Can you tell us the sort of latest and most accurate information that's out there on the vaccine, and what should people expect?
So there are many different candidates that are undergoing vaccine trials, dozens of candidates from different countries, which is very promising. I mean, I think it's wonderful to see this type of global collaborative effort, public-private collaboration that's going into this. I mean, the issue, though, is we do also have to be optimistic but realistic at the same time. Vaccine development is very complicated. It usually takes years, on the order of 4, 5, 6 years to develop a vaccine. And of course, there are some viruses that we have not yet developed a vaccine, like the HIV for HIV/AIDS. And so we do have to just be realistic that we hope that there will be a vaccine. We hope that it can be developed quickly, within a year to a year and a half. But we also just have to be realistic too, that there is a period of time, and also that until that happens, without a cure, without readily available treatments, that we do need to focus on these other preventive measures. I'm not saying to shut down our societies forever, but just understand the caution that we must all have to keep on being on guard. And again, to knowing that risk is cumulative, to limit our risk as much as possible. Some people may have to go to work, but that does not mean that just because you're at work that you can let down your guard in other things. You may have to go to work, but that's still no reason to have a picnic with your bunch of friends either.
I see. No, that makes sense. And can you talk to us about the resurgence of this virus? Because that's another conversation that's going on news outlets, and people are now talking about the next wave of COVID-19 hitting next year. What can we do to minimize that risk? Is there anything that people can do to sort of mitigate the risk of this resurgence?
I mean, we know what works in this case. Again, absent a vaccine, absent a treatment, what works is social distancing. We've seen countries where this has been highly effective, that social distancing stops the virus in its tracks. Then you combine that with a combination of testing to identify each individual who is positive for the virus. Then you isolate, or then you contact all the individuals that they could have been exposed to through contact tracing. And then you quarantine those individuals, you isolate the people who test positive, and that's how you keep the virus in check. That's what works. We've seen this work in numerous countries in Asia, in Europe, also Australia and New Zealand. We know that this could work. The US, I'm afraid, is prematurely opening without having those testing, tracing, isolating capabilities in place. And I do worry about what that will mean, because at this point, it will mean a resurgence of infections and, unfortunately, deaths.
And I want to talk about that, doctor. I mean, I try to make these conversations as genuine, as authentic as possible. There are millions of Americans who are listening to the administration and are rooting for the opening of restrictions and the lockdowns. And absolutely, I understand, like you said, and you as well, that people have to go to work and life has to somehow go back to normal. But what do you say to people who are fighting for this instant opening and this immediate, just flooding of business as usual in the States. What is your message to them as a mother and also as a physician?
I mean, it's really hard because I know that there are major consequences too, of course, to not having schools open, not having jobs. I mean, so many people have lost their livelihoods as a result of this, and it's heartbreaking. And I think so many people at this time are making just incredible sacrifices. But I don't want for us to be seeing this as a choice between public health and the economy. I think a lot of people have framed it in this way, and it's not at all. I mean, we all want the same thing. There's not a single person who wants for society to be shut down just for the sake of it. But rather, it's a question of how do we reopen safely? What are the things that we have to have in place? Because otherwise, we're looking at a lot of preventable deaths. At the beginning of this outbreak, we could have said, and I think it is true, we didn't know what it would take to prevent these deaths. We didn't know because there was so much about this virus that was unknown. And by the time we knew, certainly in the US, there was already a lot of community transmission happening. But at this point, we do know what it takes. And so I think that each of us can continue to do our part. And so if you are an employee, for example, you can continue to ask about telework options. If you have to go back to work, ask your employer about what they're doing to keep the workplace safe and what protocols you can also be using to keep yourself safe as much as possible. And for everyone, I would just advise that we continue to practice social distancing to the extent that we can. Just because you can go out and be around others doesn't mean that you should.
Right. I'm curious, you mentioned other countries. I'm curious as to what country do you think has done a good job in handling and mitigating this virus, and why?
Yeah, I mean, I think there's objective data about this. The countries that have really been able to prevent the spread of the infection, or even if they had a spike in infections, that they were able to contain that. And so I think quite a few Asian countries were able to do this. I mean, China, for as many issues as we might legitimately pin on them in terms of not being as transparent as they should have been earlier, was able to very aggressively contain the infection. We saw Singapore, South Korea do a fantastic job also with the amount of testing and contact tracing, quarantining, isolation. They're great examples of this. New Zealand is another good example. And so I think that a lot of countries have acted very quickly and have shown how social distancing works when it's done early, aggressively, consistently.
I think in the US, again, I come back to the United States, this issue has become very politicized, and people are sort of getting lost in the heat of the momentum and in the politicizing of this issue. What's your message to them, again, as a physician and a mother?
I mean, this is not about politics. This is about people's lives. When we ignore science, we will pay. And unfortunately, that's what's happening now. I mean, this is a pandemic. I mean, a pandemic doesn't care what political affiliation you have. And really, we need to be listening to the doctors and scientists. And we've seen, again, I think in the countries that have done very well, they have followed the data, they have followed the science. It has not been about partisanship or ideology.
Right, that's an important point. Talking about politics, you are Chinese American, and I myself, I'm an Iranian American, and I'm quite proud of the contribution of the immigrant community, especially healthcare workers right now, to the society in the US and of course elsewhere. I want to talk about the negative feedback and comment and just very bigoted behavior we're seeing from some people in the US and also around the world against the Chinese people. I mean, how does that make you feel? And what do you want to say about that?
Yeah, I mean, it's I look at the WHO and they've done an incredible job, I think, of putting together a whole committee that has a sole goal of naming diseases. And they do that for a reason, because they know that when a disease is named for a region or a country or people, that it leads to stigmatizing and fear and frankly racism, in a way that's just totally, it has no purpose, obviously, but because the disease is something that affects all of us and could have started anywhere, and it could have been about any of us, and now is about all of us. And I look at the racist attacks that have already happened in different parts of the world, physical acts of violence as well as verbal abuse. And
Exactly.
that's just things that should not be happening. And I would expect for our government leaders to behave better than that. But also, I think it's something that all of us as individuals have a role in correcting. We should not be calling this virus anything else than SARS-CoV-2 that causes COVID-19, the novel coronavirus. I mean, these are the scientific, medical, unbiased terms that are used for this coronavirus. And I would just say to your question about how I feel about this personally, I mean, I am Chinese American. My parents and I immigrated to the US just before I turned 8. We stayed on political asylum in our adopted country. This is my country. I've had, since this virus first started, because I've been prominent in the media answering questions about it, I have had people on Twitter and other panels accuse me of all kinds of things because of how I look and because of my ethnic background. And I've seen this firsthand about the impact of our attitudes about this virus. And I think it really is up to us to point out that, just like all other diseases, this is something that does not discriminate. It doesn't matter what we look like, how we sound, where we come from. We're all at risk for getting it. We're all at risk for spreading it. And that's why we're really all in this together.
No, absolutely. And I usually repeat this in my interviews. I kind of reverse it and I say, this is a very rare and humbling moment that's bringing all of us from all walks of life, from different countries, ethnicities, backgrounds, religions, cultures together. So instead of looking at it as a divisive method, which it absolutely is not, but on a very fundamental level, this is bringing people closer to one another, and it should. It's important that people like yourself, do what you do. So thank you for that. It's a critical time. I really appreciate that comment. Dr. Wen, I want to talk about mental health because I know you were an advocate for that. I am too. My focus is mainly on war-torn children and refugees and dealing with the trauma and PTSD that they face. You've done a lot on that topic as well. So let's talk about that. What are some dangers right now as people go through the pandemic, whether it be lockdown, quarantine? How should we be careful about possibility of developing mental health and emotional and psychological, challenges and issues? And how can we work on preventing these challenges?
Yeah, I very much appreciate the question and also all your work and attention to mental health and trauma. I think too often we see health as just about physical health, as opposed to understanding that mental health is just as important as physical health. And we need to, again, remove the stigma and fear and shame of mental health too. And it just is a really important component for us to address, absolutely. And so I think in the COVID-19 crisis, there is so much that affects mental health. There has been some attention about the isolation component, about especially older individuals, those who already may have had mental health concerns, being even more separated from their loved ones and supports. I think there needs to be more focus also on addiction and on behavioral health issues, because again, that's something that would be exacerbated by this pandemic. But I think there also needs to be attention too to the individuals who are surviving COVID-19 as well, because for many of these individuals, they'll be in hospitals for long periods of time. And I think for many others who are losing their jobs and their livelihoods and are just struggling in different ways. So I think if it's anything else with COVID-19, I hope that there will be a clarion call to address some of these issues that have been long neglected and are yet so important, and mental health would certainly top that list.
How do you think partners can help each other? I'm here in Stockholm with my partner. We're stuck here before we can go back to London. You're there with your partner. Again, mental health is not something that we talk about even in Europe or the United States, let alone, you know, the Middle East or, you know, other countries and parts of the world. What are your tips and advice on being able to more comfortably talk about these issues as couples go through the pandemic together, or if you're by yourself? How can people feel comfortable raising the issues that they may have? What are your tips and advice?
Yeah, I mean, I think a lot of it has to be being able and being willing to talk about it. And sometimes it is with those closest to us that we feel the greatest barriers to. You know, in my first pregnancy, after I delivered Eli, I mean, he was and still is the joy of my life, and I really, you know, it was amazing to have this little baby, but I also really struggled, and I actually denied that I had postpartum depression. Even though I had studied it, I'm a practicing physician, I knew what to look for, but I still did not even want to admit it to myself or even to my husband. And it took me some time to even be able to talk about this issue. And I know how difficult it is, even with the ones that we are the closest to, who want to support us the most, how difficult it is. And so I do just, you know, want to say, I think it is just very, very challenging, but opening up and having that initial conversation, and the other way around, also giving your partner the space to be able to express this, is so critical too.
As a mom who just gave birth a month ago, and also having a 2.5-year-old, what keeps you up at night, Dr. Wen?
Well, other than the obvious, which is actually the baby crying. So that literally keeps me up at night. I mean, I worry. I worry about the times that we're in. I can't help but do that, but I think, you know, most of us probably are in that position. I worry about the future that we're leaving for our children. But you know, there are so many circumstances out of our control, but what's in our control is how we treat each other and the humanity and the kindness that we bring. And I hope that that's something that we can just hold sacred.
Is that what makes you be optimistic? What are you hopeful for right now?
I mean, I see people coming together during this pandemic. I see also just the, you know, the level of understanding and empathy that we have for one another. And absolutely, that's what gives me hope during this challenging time too.
Well, thank you so much. I wanted to leave it on that hopeful note. Dr. Leana Wen, joining me from Baltimore, if I'm not mistaken. You also live in Baltimore. Well, I really appreciate you being with us, and I will share the great articles you have written on pregnancy and what to do, and the other information that you've shared publicly.
Wonderful. Well, I really appreciate your inviting me to be here with you today. I wish you all the best.
Thank you.
And really, thank you so much for everything you do.
Thank you. I appreciate it. Have a wonderful Mother's Day.
Thank you.
You and all the mothers out there, expecting mothers. Thank you, Dr.